So I am here going to give a manual ventilation to this patient. So first is I'm gonna have to wash my hands, and then I have to wear designated PPE such as gloves, mask, and even goggles. And then after that, we have to assess the patient first by checking its vital signs, auscultate, and then we have also a finger as pulse oximetry. Gonna put this in the patient's finger to check if what's their SpO2. And then we should have also different kinds of sizes of the mask. So first is when we try it, this medium size, it won't even fit the entire face, or even as we notice. So good thing that we have a different size for in case of those kind of scenarios. So you notice that the large size is able to fit the entire face, such as the nose and the mouth. And then once we're good to go, we have here an ambu bag. It should be inserted to the flow meter. Set it to 15 liters per minute. And then before proceeding, we should have able to observe this bag to inflate, as we notice. And then another thing is we have also make sure that the ambu bag has no any loose connections such as this one. And then also I think that's all for this, maybe for the ambu bag. And then we have to put this one up to the mask, make sure it is tight. And then we have to put this to the patient's face, and then we have to make sure that it's entirely sealed, make sure that it's being covered, the mouth and the nose. And then we have to do a head tilt chin lift while making a seal on this, and then giving appropriate breaths for about 12 to 20 breaths per minute. And then another important thing is we noticed that I was kind of having difficulty in making a seal. We could also have another option to have another person in order to give an appropriate seal, and at the same time giving a head tilt chin lift, so that I will be able to focus in giving manual breaths to the patient. And then when giving manual breaths, we also have to notice the patient's chest, especially if you notice that the chest rises. And then when also if we notice the patient is having a spontaneous breath, we will also have to coincide with the patient's breath, so that we're not able to have any desynchrony while giving manual breaths. And then once we're done, we have to put this first on the side, make sure that after we're done, we should dispose this mask, turn the flow back to zero, sure that this bag will be deflated, then remove this connector, then put it on a safety side. And then we have to reassess again the patient, as what we did earlier, post vital signs, checking the SpO2, auscultate. Then once we're done with doing those, we have to either attach it with a intubate the patient, or a non-rebreather mask. And then we remove the PPE that we wear, wash our hands, and document everything.